Hi, everyone, and welcome to our debate. My name is Haley, and I will be the moderator for our debate. Right now, I'm just going to introduce all of our group members. First, we have Kristen, who is the stater.
Hello.
We have Jessica, who is the pro-prover.
Hi.
Kayla, who is the con-prover.
Hi.
Greg, who is the pro-attacker.
Hello.
And Miriam, who is the con-attacker.
Hi.
The issue we will be debating is the use of punishment-based intervention, and these are among the most controversial treatments for behavior disorders in applied behavior analysis literature. The controversy concerns both the efficacy and the ethics of punishment, as well as that both researchers and practitioners tend to argue for or against the morality of punishment by developing a position on its efficacy. Some scholars have argued that punishment is without harmful side effects, making punishment unethical. Alternatively, other scholars have argued that punishment, especially when used in conjunction with reinforcement, has efficacy superior to that of reinforcement alone, making punishment at least sometimes ethical. In this debate, we will consider the ethical code as well as the literature to argue whether or not the use of punishment is ethical and determine its efficacy. Right now, I will just bring up a visual and discuss the definitions of reinforcement and punishment. So reinforcement increases the frequency of desirable behavior, and punishment decreases the frequency of undesirable behavior. And according to the definitions by Cooper, Heron, and Heward, punishment is a two-term behavior where its consequences, functional relations, is defined by its effects on the future frequency of behavior. Punishment has occurred when a response is followed immediately by a stimulus change that decreases the future frequency of similar responses. And reinforcement may be defined as when a type of behavior is followed by reinforcement, there will be an increased future frequency of that behavior. So simply put, punishment decreases the likelihood that a behavior will occur in the future, and reinforcement increases the likelihood that a behavior will occur in the future. Now, Kristen will state the first point of the debate.
So the first point to be made is by the pro-punishment side in regards to the literature supporting the idea that punishment is an effective procedure in reducing or eliminating maladaptive behaviors rapidly. It has also been found that behavior change programs using positive reductive procedures may benefit when combined with punishment. So Jessica, I'm going to hand this off to you and let you begin by proving this point for the pro-punishment side.
In 1969, a study by Lovaas and Simmons showed that punishment was immediately effective in reducing self-injurious behavior in comparison to placing students alone in a room. The behavior was immediately suppressed when an electric shock was administered, and when the shock was taken away, the behavior returned, showing the effectiveness of the punishment procedure. Another study by Lovaas in 1987 also showed that 90% of children substantially improved when using the Lovaas method, and over half of these children were able to achieve a normal IQ score and tested within the normal range for social and adaptive skills. Another study done by Hanley, Piazza, Fisher, and Maglieri in 2005 showed that clients preferred treatments when punishment was part of the treatment plan. In their study using functional communication training, they used procedures that involved punishment and procedures without punishment, and proved that the procedures were more effective when punishment was used. Also, when clients were asked to choose which treatment they preferred, one student picked the treatment with punishment 79% of the time, while the other picked punishment every time during her last 5 sessions. This directly relates to Code 4.02 involving clients and treatment. The client should have a say in which treatment they prefer, and this will make the treatment more successful because the client will be invested in their own treatment and will be happier overall with the treatment being used. I am now going to show a graph that will explain this further. Fisher and colleagues in 1993. The top graph shows that during baseline, there was a high rate of destructive behavior and a low rate of functional communication among participants. As functional communication was implemented, communication increased and punishment decreased, but still was somewhat variable. The bottom graph shows that the rate of destructive behavior per hour remained high and variable during functional communication training and the use of extinction, but when punishment was introduced with the use of functional communication training, the rate of destructive behavior immediately dropped and remained at a decreased level.
Thank you, Jessica. Miriam, what comments do you have about the effectiveness of punishment alone and when used in combination with reinforcement? What arguments do you have against the findings that Jessica just provided?
In regards to the Lovaas study, it's not a surprise to hear that someone discontinued engaging in undesired activities due to being shocked. I don't think anybody would like to be shocked, and this is also a violation of our duty to do no harm to our patients. Yes, clients do have a right to make decisions in regard to their treatment, but I am unsure that they would agree to this treatment, though I am persuaded to believe they would choose other types of punishment. I would also like to bring your attention back to the graph that was just shared. Just a second here. As Fisher et al. Shows in the top part of the graph, the functional communication training did actually decrease the behaviors when the treatment was in effect. During baseline, the destructive behaviors were high again, and the communication was lower, but once functional communication training was reintroduced, the destructive behaviors did drop again. And while it does show that the communication training helped keep the destructive behaviors low, it was not much different than before the extinction was involved. Cooper, Heron, and Heward in 2007 also explained the importance of differential reinforcement. And let's see, this can also be considered when trying to use treatments that do not involve punishment. So these are useful because they help decrease behaviors, but also teach alternative behaviors or incompatible behaviors instead of just implementing a punishment procedure and expecting that behavior to go away. These differential reinforcements are important because they not only provide that alternative behavior or support the decrease of that behavior, but they also withhold the reinforcement as much as possible when these problem behaviors occur. Differential reinforcement is one of the least intrusive of all the behavior interventions, and it's probably why it is so important. It does not involve extended interruptions like timeouts, and it does not rely on the removal of positive reinforcers like response cost, nor does it present aversive stimuli to the individual like punishment does. Differential reinforcement has a dual effect. It not only weakens the problem behavior while simultaneously strengthening the acceptable behaviors that are incompatible or alternative. Back to you, Kristen.
Thank you both of you for stating your positions. Although the pro-punishment side has suggested that punishment can increase the effectiveness of reinforcement procedures, the con-punishment side will be arguing that when implemented alone, reinforcement is more effective than when punishment is implemented alone. Kayla, please provide us with the support for this statement.
Punishment is only shown to be effective in combination with reinforcement. Fisher and colleagues, 1993, showed that functional communication training was effective in reducing some destructive behaviors, but not as efficiently when used with punishment. The study also shows that when using functional communication training and reinforcement procedures, replacement and adaptive behaviors were taught successfully, but punishment could not do this. Ethical Code 4.08 states that a replacement behavior and a way to teach the behavior must be in the plan if using punishment. So punishment shouldn't be used alone, and this code supports the idea that punishment will not be able to teach new replacement behaviors. Wheatley and colleagues found that the following evidence-based practices are effective when reducing problem behaviors in common areas of schools without utilizing punishment: establishing a common language to communicate behavioral expectations, delivery of specific praise, active participation of school personnel, token reinforcers that are delivered immediately in exchange for other reinforcers later on, and the use of differential reinforcement of incompatible behavior.
Greg, Kayla has made several points that reinforcement on its own is effective without punishment. Can you provide us with support of when punishment should be used and if it can be used on its own?
All right, well, code 4.08, which is part of the ethical standards for BCBA, does state that punishment can be used. Punishment has one use, and that is to quickly suppress the behavior. This would be the main goal when dealing with major aggressive incidents or self-injurious behavior. Code 4.08 also states that we should use punishment as well as reinforcement at the same time to help individuals learn those alternative behaviors. This would also be true as no matter whom you were working with to try and change behavior, we would want to look at the alternative behavior that they would need. The research does not show how reinforcement alone can quickly stop, let's say, a self-injurious behavior. Punishment has been proven to quickly stop a behavior, and then from there we can look at what the next steps would be. The bigger issue around punishment is the fact that people have not been able to replicate it successfully outside a clinical setting. Lovaas, in his 1987 article, stated that it is unlikely that a therapist or investigator could replicate our treatment program for the experimental group without prior extensive theoretical and supervised practical experience in one-on-one behavioral treatment with developmentally disabled clients as described here, and without demonstrated effectiveness in teaching complex behavioral repertoires as in imitation behavior and abstract language. It is unfair to state that punishment is not as effective as a reinforcer when it has been proven to be quite effective. The problem arises that in a non-clinical setting, therapists who are not trained correctly or staff whom are not trained correctly don't use punishment immediately, consistently, frequently, or with the proper intensity. The stigma around punishment has been created due to improper training and is not a result of an inadequate treatment model.
Now that we have heard from both sides why punishment and reinforcement procedures are effective together and alone, we'll move on to our next topic. The con-punishment side will provide an argument in relation to the Ethical Code 4.09 regarding the use of least restrictive procedures. Kayla, please explain why reinforcement rather than punishment would be less restrictive.
According to the Ethical Code 4.09, we should always recommend using least restrictive procedures. Rackman and Teasdale indicated that reinforcement procedures should be implemented as part of a regular procedure, and punishment procedures should only be used when other procedures have been unsuccessful. Homer and Peterson stated that reinforcement procedures have been proven to be comparably effective as punishment procedures, and positive procedures avoid the unpleasant effects that may occur when using punishment procedures. Reinforcement procedures that have been proven to decrease problem behavior include differential reinforcement of other behavior, differential reinforcement of low-rate behavior, alternative behavior, and incompatible behavior. These reinforcement procedures are easy to implement and are constructed on providing positive reinforcement, which avoids any ethical concerns that may arise while using punishment. Wheatley and colleagues conducted a study in which they utilized differential reinforcement of incompatible behavior in schools due to a need of low-cost, high-impact strategies to increase appropriate behavior. It taught specific, appropriate behaviors, provided opportunities to practice skills, and implemented systems to reward students for behaving appropriately. Right now, I will provide a graph from the study to show the effectiveness of reinforcement strategies. The graph shows a significant decrease in target behaviors that were occurring in school common areas. Common areas occur 50% of the target areas in schools. These areas include hallways, lunchrooms, playgrounds, bus line, and buses. The target behaviors included littering, which was decreased by 96%, sitting inappropriately, which decreased by 64%, and instances of running, which decreased by 75%. In this study, positive behavior support was implemented to decrease the target behaviors, and it was successful. As I previously stated, multiple evidence-based methods were used to reduce these problem behaviors. They included providing clear expectations and using common language, consistently delivering praise, encouraging active supervision, implementing token economies, and utilizing differential reinforcement of incompatible behavior.
Greg, Kayla has used code 4.09 to support the use of reinforcement as a less restrictive and less intrusive procedure. But when would punishment be considered the less restrictive procedure?
Well, why would we want to use a less restrictive procedure if someone is constantly banging their head with great intensity against hard objects? It does not seem to me that using the less restrictive method at this point would make sense. Why would we not immediately look at how we can suppress the behavior and then look at creating the alternative behavior? The responsibility of explaining to a parent that I am sorry your child has brain damage, but I had to try the less restrictive procedure first is not a conversation that I personally want to have with anybody. Ethical Code 2.09 states that clients have a right to effective treatment. Therefore, if punishment is the best procedure to start with, that is what the BCBA should consider. The BCBA would explain to the parents or individual, if they are their own guardian, why they are choosing punishment first, and explain some of the research behind it. Everyone has a right to treatment, and we should be providing the best treatment possible on a case-by-case basis. An overarching principle throughout life and for BCBA is to do no harm. There is no BCBA whom is ever going to knowingly place one of their clients in harm's way. The other great part about a punishment procedure is that the procedure will be reviewed by a select group of people to make sure that there is a justification for the use of the procedure, that alternative behaviors are being looked at by the treating BCBA, and that the BCBA is attempting to end the procedure at some point in time. No matter what procedure you use, whether it's punishment or reinforcement, we need to always be looking at how we will stop the procedure so that the added stimuli to the person's life can be discontinued and natural environmental consequences can take over. The Golden Book that many BCBAs refer to when discussing behavioral literature by Cooper states that punishment is a legitimate therapeutic technique that is justifiable and commendable when it relieves persons of an even greater punishment that results from their own habitual behavior.
The pro-punishment side is now suggesting that in situations where reinforcement has not been found to be effective in reducing maladaptive behaviors, that punishment can be potentially allowable and viewed as a less restrictive procedure. Jessica, what support do you have in regards to this statement?
According to the BACB Code 4.08, Sections B and C state that reinforcement procedures should always be used if punishment procedures are necessary. It also states that if the behavior is dangerous enough, immediate aversive procedures can be used. And if the behavior is not dangerous, appropriate steps must be taken in order to implement reinforcement along with the punishment procedures. Code 4.05, Conducting a Risk-Benefit Analysis, also states that the benefits of a punishment procedure must outweigh the risks. Cooper also states that clients have the right to effective treatment. He states that by failing to use a punishment procedure when it is absolutely necessary may be failing to provide effective treatment for the client, and it may also put the client in harm's way.
William, both Greg and Jessica have made valid points supporting the use of punishment and stating that it could be used over reinforcement as a first choice in some situations. But please explain to us why you would not automatically choose punishment as a first choice.
Will do. Greg, I would like to briefly go back to something you said. You are correct. Ideally, nobody would intentionally put someone in harm's way in order to be able to use a punishment procedure. However, this may be done unknowingly. Cooper does say that people have a right to effective treatment, but who is saying that reinforcement is not effective? I would also hate to tell parents that we jump straight to a punishment procedure without trying the least restrictive alternative first, for the mere fact that we thought it would end the behavior quickly. We do not know that this will be the case. There are other ways to decrease behaviors without using punishment. Yes, we want to end dangerous behaviors quickly, but reinforcement can also do this. Athens and Vollmer, 2010, showed that DRA effectiveness without punishment and extinction is possible if it uses more immediate, longer duration, or higher quality of reinforcement for appropriate behaviors relative to the reinforcement for the problem behaviors. So for example, if a patient's engaging in a severe behavior, such as aggression or headbanging, it may not be possible to withhold or delay that reinforcement, but it may be possible to manipulate the parameters of the reinforcement, such as the duration or the quality, in order to favor the appropriate behavior. This could mean that the function of the severe behavior is attention. In this case, minimal attention is given to the problem behavior, or attention is given in a boring way. An increased attention that is more fun in nature can be engaged in when the target behavior is not being presented. And this will make the patient want to refrain from engaging in this behavior in the future because they'll likely prefer the positive attention. It's also helpful to note that intermittent schedules of reinforcement also help because it helps mimic the natural environment.
Okay. So far, we have discussed whether or not punishment and reinforcement are effective and when both are considered to be the less restrictive option. Now the pro-punishment side will argue their next point, stating that punishment procedures should and could be viewed as humane and ethical due to the fact that the consent of the client or the caregiver must be provided prior to implementation, and how this relates to Code 2.09, the right to effective treatment. Jessica, please provide us with the pro-punishment side's position.
A study done by Hanley, Piazza, Fisher, and Maglieri demonstrated parents being involved in the use of punishment. They allowed the parent to choose what would be a punisher and what they thought they would be able to consistently implement at home. This ties directly into Code 2.09, Right to Effective Treatment, because the parent is given the choice of what they think will be the most effective punisher for the child. The Judge Rottenberg Center in Massachusetts uses a form of shock therapy as a means to decrease or eliminate severe self-injurious behaviors or aggressive behaviors. There are numerous parent testimonials on their website praising the center and the job they do with their children. These parents make the choice to send their children to the center and give consent for the center to use these methods. The parents state that their children might be in a psychiatric facility or heavily sedated, and due to the work of the Judge Rottenberg Center, they are able to be more independent and have been taken off of many of their psychotropic medications. This could be seen as using the least restrictive approach for treatment due to the fact that children are no longer heavily sedated and not in a psychiatric facility.
Miriam, Jessica has just provided us with support as to why the pro-punishment side is rejecting these claims. But please prove to our audience why you believe punishment is inhumane and unethical.
First, I would like to share a video clip from the Judge Rottenberg Center.
This is the video that the Judge Rottenberg Center in Canton has fought long and hard to keep from the public eye. The center convinced a judge 8 years ago to seal it, and the battle continued right up until it was played in court, as lawyers for the center asked the judge to bar our camera from recording it. The judge said no, and now for the first time ever, the public can see for itself what these controversial electric shocks look like in use. Dramatic video of New York teenager Andre McCollins, restrained face down, a helmet on his head, screaming for help. Judge Rottenberg Center calls it treatment. I was shocked when we were 16 or 17. McCollins' attorney just described, the teenager was shocked 31 times in all that day in 2002. McCollins is suing the Canton-based center, calling it torture. Lawyers for the center and its clinicians say McCollins needed aversive therapy because he was aggressive.
These are dramatic takes, there's no question about that. But the treatment plan at the Rotenberg Center, the treatment plan that Andre had in place on October 25 was followed.
It was an emotional day for McCollins' mother, Cheryl, who was in court as video was played from the beginning of Andre's ordeal, when he was shocked and restrained after refusing to take off his coat.
I never signed up for him to be tortured, terrorized, and abused. I had no idea that they tortured the children in the school.
Cheryl testified what her son was like when she visited him 3 days later.
I couldn't turn Andre's head to the left, to the right. He was just staring straight. I took my hands and I went like this. He didn't blink.
Cheryl McCollins did get Andre to Children's Hospital that day, where he was diagnosed with acute stress response caused by the shocks. The jury also heard her testify about watching the video and hearing staff members laughing while her son was on the floor. We should see more video on Wednesday in court as Cheryl McCollins returns to the witness stand.
Now, as we saw, this individual was shocked 31 times. And it was asked by the center to keep this video out of the trial, but the judge ruled against it. His mother admittedly enrolled him here, but she said she did not sign him up for abuse. Yes, parents can and should have a say in the treatment of their children, especially in cases where the child cannot make these decisions on their own. But can we honestly say a parent would knowingly put their child through this sort of treatment? This patient got tased for not taking off his jacket. I do not think that this is a definition of a self or an aggressive behavior. Yes, this form of punishment may be effective in regards to decreasing the behavior because, as she described her son, he sat still, not moving. However, creating a catatonic-like state for someone is not what I would consider a successful procedure to decrease behaviors. As behavior analysts, we have multiple obligations. These include, but by no means are limited to, doing no harm, respecting autonomy in order to help promote independence, benefiting others, being just, and treating patients with caring and compassion. This treatment is clearly causing harm to the young man. It's important to consider what the subject wants out of treatment, as well as what the parents want. After all, this is to be done to help the subject, not the parent. If the exact treatment was spelled out for the parents and the subjects, I do not believe anybody would sign up for this. And what about the scene is benefiting anyone? What good is shocking people going to do? Are you saying that if you engaged in a dangerous behavior, you would be okay with someone strapping you down, placing a helmet on your head, and shocking you multiple times while you beg for them to stop? We are to do to others what we would like to happen to us. I know I would personally not enjoy being shocked, no matter what effect it had on my behavior. Is it caring or compassionate to do these things? I would think that finding the least restrictive way to decrease these behaviors would be more caring and compassionate. I would even go so far as to say that the behaviors they are engaging in are sometimes more compassionate because they may not inflict the type of pain that these procedures are causing. I won't go into every ethical code this violates, but these are some of the basic essentials each human being should be ethically obligated to uphold. And the argument that punishment, specifically the Judge Rotenberg Center, is effective and should be allowed due to parent choice seems ridiculous. Rather, I would argue that the use of punishment is inhumane and that reinforcement has been found to be effective in reducing problematic behaviors.
Miriam has pointed out several violations to our ethical code and our compliance code and principles. She has also provided us with a clear example of how punishment can be severe and potentially harmful. Kayla, what does the literature state about the negative side effects of punishment?
Homer and Peterson stated that punishment procedures have resulted in aggression and unpleasant reactions. The researchers have also indicated that punishment procedures may be subject to inappropriate use and misinterpretation. This may include overusing or forcefully using punishment procedures. In the study done by Fisher and colleagues, the researchers looked at the effects of using functional communication training and punishment with all of their clients. The researchers found that in one of the cases, aggression and self-injurious behavior increased when punishment was implemented alone for disruptive behaviors. However, when punishment was included with functional communication training for disruption, rates of aggression and self-injurious behavior stayed low. In this case, the study revealed that functional communication training may have prevented the occurrence of aggression and self-injurious behavior by increasing communication. This study has shown that when reinforcement procedures are used alone, they are proven to be effective in decreasing maladaptive behaviors while increasing adaptive behaviors.
Greg, what can you offer to our audience to counter the statements from Miriam and Kayla? These examples are clearly concerning about the negative side effects of punishment.
Well, I'd just like to start off by saying that the Judge Rottenberg Center has been brought to court over 8 different times, and they have been found to use ethical principles and are still open to this very day. In that video, I'm also not so sure that they were using punishment in the proper way. It would depend on exactly what was said in the behavior plans and whether or not there was a clinical person there to make sure that it was followed as designed. But again, let's discuss Ethical Code 2.09, which states that an individual should have effective treatment. Why would we not use punishment procedures when they are effective, they're fast, and they could save a child from serious brain damage or injury? We can work on teaching alternative behaviors after these behaviors have been suppressed and the individual is no longer a danger to themselves or others. Places like the Judge Rottenberg Center conduct punishment in a clinical setting with consent oversight from the clinical staff. It is these punishment procedures that some call inhumane that parents have seen as life-saving. Are we trying to say that in order to save someone's life, we would never consider punishment when it has been proven effective? I would certainly hope not. With that said, parents and BCBA should not be implementing punishment procedures without having the proper training first. But it should be considered rather than allowing somebody to continue to be aggressive or self-injurious when the punishment procedure could have life-changing effects. In closing, I want to make it clear that punishment is a form of treatment that is covered under the ethical standards and has been proven effective. Punishment's one use is to suppress the behavior, and oftentimes it is seen as failing due to improper implementation. When punishment is immediate, consistent, frequent, and has sufficient intensity, then it will be effective, and alternative behaviors can then be taught after. Punishment should always be considered when the cost of not punishing is greater than the cost of the punishing itself.
Thank you to both sides for sharing your points. Throughout this debate, we have heard some great points from both the pro and con sides. To conclude, both reinforcement and punishment have been proven to be effective treatments. Both have been proven to be effective in reducing maladaptive behavior, with reinforcement using differential reinforcement of incompatible behavior, alternative behavior, other behavior, and low rates of behavior, as well as functional communication training. In addition, both reinforcement and punishment procedures have been able to terminate dangerous behaviors quickly. To wrap up, punishment is often most successful when combined with other treatment methods, and punishment procedures should not be implemented without proper training. A reinforcement or punishment procedure should be selected dependent on the function and severity of the behavior. Regardless of which procedure is selected, a BCBA who is implementing these procedures must obey the Code of Ethics. In the Code of Ethics, it does state that it is the decision of the client and client's family in the selection of treatment procedures, but it is also a BCBA's responsibility to educate the families on both reinforcement and punishment, and which will be most effective in that client's case. To conclude this debate, we will now have a short question and answer session. Our first question is, how can you help a parent understand the use of punishment procedures as part of their child's treatment plan, and what concerns might come up?
To help the parent understand the use of punishment, we must clearly define punishment. It can be defined as a procedure that is used to reduce or eliminate a problematic behavior. An aversive event is presented after the behavior, or a positive stimulus is removed in order to reduce the likelihood of the behavior occurring in the future. Another important thing to explain to the parents is that punishment does not always mean the child will be made to be in pain or uncomfortable. It could simply mean that something is being taken away. We should also provide the parents with rationale why punishment is necessary. This would come from the results of a functional assessment or analysis to show the urgency of eliminating the behavior, such as a self-injurious behavior or severe aggression. Another way to show that punishment is necessary is to show the data in the graphs that have been made. Kayla will now talk about the concerns.
Some concerns that might arise or parents might automatically assume that the use of punishment is something that will harm the child physically or result in negative psychological side effects. They might assume that the use of punishment procedures produces emotional reactions that could interfere with the child's learning and be unpleasant for the child, as well as the people involved in the treatment. Parents might also assume that the use of punishment may cause an increase in aggression from the child. It is important to explain to the parents the broad nature of punishment procedures and that the procedures used will only be implemented after the function of the behavior is determined in order to ensure that unnecessary punishment procedures are used. The parent should also understand that punishment will be used after reinforcement has been tried and been unsuccessful. Punishment results in a decrease in occurrence of a behavior, and something may be added or taken away from the child's environment to do so. Punishment does not automatically mean spanking, yelling, and timeouts. For example, if a behavior is for intention, then timeout is a less restrictive or aversive procedure that can be used. Also, if the behavior is escape maintained, then blocking the escape and perk is a punishment that is also less restrictive or aversive. These procedures will likely not result in harmful side effects, and when functional assessments are used prior, it will also ensure that the use of punishment is functionally related to the behavior. Also, inform parents that punishment is a short-term solution in order to address an immediate concern with the ultimate goal of reducing the behavior and then teaching an appropriate behavior to replace, but punishment may be necessary to quickly eliminate or reduce the behavior to manageable levels in order for teaching or increasing a new behavior.
Thank you, Jessica and Kayla. Our second question is that it is important to remember that punishment can be negatively reinforcing to the person implementing the punishment. For example, when a parent yells at a child to be quiet and the child quiets down, then the aversive stimuli of the loud child is removed from the parent. If this increases the likelihood of the parent yelling at the child in the future, then yelling is negatively reinforcing to the parent while punishing to the child. Given this dynamic, what strategies can be put in place to help ensure that punishment is not overused or misused?
So the first strategy that could be used when it comes to parents using punishment, as it is negatively reinforcing to them, is to start by informing the parents of what they are doing. Many parents may not even realize that they are creating a punishment situation for their kids because they focus on how it just helps them. Once we have the parents on board, we could then focus on informing the parents that what needs to be done is figuring out the function of the behavior in order to figure out an appropriate replacement behavior. At this point, we could explain to parents how punishment does not teach any alternative behaviors, and it would be more beneficial for them to teach their child than become a punisher. We can explain to parents that if their child doesn't learn a replacement behavior, they're going to continue to exhibit the same problem behavior unless their parents are there acting as the punisher. So really, in order to help their child, they should really find the alternative behavior that works and teach their child how to get what they want in an appropriate manner. It is not about overcoming our immediate challenges, but teaching our kids how to be successful as they move forward and into their futures.
Thank you, Greg, for answering our second question. Now we will have a few minutes for Kristen and Miriam to share their personal experiences related to this topic.
So I have seen both the positives and the negatives of punishment procedures, specifically timeout procedures. So the positive example was a child that I was working with. He engaged in aggressive and property destructive behaviors in order to inappropriately gain attention. So with that, whenever he engaged in those behaviors, he was put in timeout for 3 minutes and no attention was provided. Additionally, he was being taught how to appropriately request attention, whether that be simply saying hello or come play with me. And the aggressive and property destructive behaviors were ignored while he was in timeout. And it really worked because we explained the definition of the behaviors. We talked about which behaviors would be used for timeout, which would not be. And all the parents and the caregivers were consistent in their procedures. And so we did see a reduction in those maladaptive behaviors when timeout was implemented, along with reinforcement procedures of functional communication training. And I've also seen the negative side effects of timeout, especially when the function of the behavior is not targeted. So this happens a lot in schools when paraprofessionals or other staff who aren't very well trained just automatically think that these punishment procedures like timeout will be aversive to the individual and decrease the behavior. But if the function of the behavior is to escape and they're engaging in these tantrums and then are placed in timeout, then the behaviors are not going to decrease because the function wasn't addressed. So in these situations, I've had to explain that it's not working and that timeout and punishment, the punishment procedure of timeout was not effective, and that the individual needed to be taught to request a break or something that was more functionally related rather than putting them in timeout. So overall, when using punishment procedures, I think that if they're implemented correctly, if everyone understands what the behaviors are, and if everyone consistently implements them, then they can be appropriate if used along with reinforcement strategies. Thank you.
And I agree with Kristen 100%. I have seen punishment procedures work on their own. I've seen them work in conjunction with reinforcement. I've seen reinforcement work alone. But I do think the main concern is making sure that the staff know the definitions of what behaviors are being targeted, know what the function of that behavior is, and be properly trained in how to implement the punishment procedures that are going to be used. The example I'm about to tell you is kind of relating to this because while we implemented the behavior plan appropriately in the beginning, there was a curveball thrown in at the end, and we kind of just went with what we thought would be best at the time. There was a kiddo that I was working with, and he was severely neglected. He did not get much food very often at home, and we got very minimal money from mom to go to the store to get food for these kids. So if he would get mad and we did not have something he wanted to eat, he would start throwing objects, he would start hitting things, hitting other people, screaming, throwing himself on the ground, hitting his head on anything that's close to him. Basically, anything he could do, he did. So we followed the proper plan that was in his BIP. We, got him away from others. We tried walking him to calm him down. When that didn't work, we tried other restraints on him. And eventually, all of the staff were out because everyone else was busy with their clients or, we ran out of people to alternate with. So the client had to go into our crisis management room, which is our padded room with a locked door and a camera that you can watch the patient while they're in there. And the rule to open the door is that they have to be calm for 30 seconds. And he did not calm down for even 5. And he got to the point where he was so worked up that his nose was bleeding. And rather than let him stay in there and contaminate the entire room, we made the executive decision to take him out and put his safety first. Looking back at it now, we should have put gloves on first and then taken him out of the room so that we were prepared to restrain him appropriately to clean up the mess. But we were just too focused and thinking about the quickest and safest way for us to get him out of that area and get the mess taken care of so that no one was exposed to that contaminated blood. So I volunteered to hold him while the other staff put on their rubber gloves and tried to clean up the blood. But unfortunately, I was against a wall to have more support, and the client reared his head back into my face, and I still have a scar to this day, and had to take an 8-hour trip to the emergency room that night. So while punishment can be effective. It's not always the case, and we need to always be prepared for situations like this where we try our best to implement them appropriately, but they don't always quite go as planned. And we take that information and we learn from it so that next time that doesn't happen.
Thank you, Miriam and Kristen, for sharing your experiences. Thank you to everyone who participated in the debate, and thank you to everybody else for watching.